Hello, and welcome back to the Mind Clinic. I am Chinyerugo, a clinical psychologist. On this episode, we're going to be speaking to a psychologist on the truths about mental health. If you're a fan of this show, please remember to follow us on Instagram and on Twitter. Our handles are Neem Sanctuary. You can also reach us on WhatsApp on 0706 062 5054. I hope you got that number, but I'll be glad to repeat the number at the end of our conversation. So like I said earlier today, we are going to be speaking about the mental health truths in Nigeria. Today I have with me a guest speaker. He is also a psychologist, a clinical psychologist, and he will be introducing himself to you. But his name is Hassan Tajuddin, and he'll be speaking to us about some of the myths about mental health in Nigeria. Hey Hassan, how are you doing?
Hello Chini, thank you. My name is Hassan Tajuddin. I'm a clinical psychologist with NIM Foundation. And I'm happy to be here.
So Hassan is a man of few words. Hopefully he will give us more conversation with as we progress. All right, so mental health in Nigeria has been quite an interesting topic and conversation to have. And I think it has been clouded by a lot of myths and a lot of false narrative about what it is. So, at every point, always looking for ways to change the narrative, to change the conversation, and to say the truth about mental health, so that people, when they talk about mental health, the connotation is more about the facts and the truths about what it is, rather than the, for lack of better words that are not true. So that's what we're going to try and dispel, like some of the myths, and talk about the truth. One of the big things that we hear a lot in Nigeria about some of the statements that has been made about mental health is that mental illnesses or mental health challenges are as a result of a spiritual attack or for some spiritual reason. So can you help us shed some light on this as we look through many other statements? So mental health is spiritual. What are we saying to that?
Well, thank you, Chini. The mental health environment in Nigeria is actually changing. The knowledge gap is being bridged, and over time, in recent years, the narratives too are changing.
Okay.
People are becoming more enlightened about mental health. However, that is not to say that we still do not have the myths that surrounds mental health in Nigeria, which points to the fact that there's a lot of work to be done in enlightening people about mental health. And I think that is why even this, what we are doing now, is very, very important to that effect. Is mental health spiritual? Well, from scientific point of view, it is not.
Okay.
But the misconception that mental health is spiritual might not be unconnected with the history of the people and cultural practices, and as well as expectative tendencies of some spiritual leaders in religious organizations who use the ignorance of the people to exploit them about mental health. And all of these have helped to engender the belief that mental health is spiritual.
Yeah.
But mental health is actually not spiritual.
Okay.
Mental health and mental health condition, mental illnesses are just like every other health condition, where when people get, for instance, fall sick with certain illnesses, they get treated for them and they get better. So also is mental health.
Great, thank you. So just like your physical health, your mental health can be treated. It's just like a sickness, like a health problem generally. Yes. One of the things, or one of the statements that we also hear is that certain people can experience mental health problems. How true is that? And maybe what are the risk factors if that's true?
Yes, certain people can experience, can be more predisposed to certain mental health conditions than others. And this could be connected to a lot of factors, which are both biological, social, and economical in nature. Some biological factors due to hereditary conditions. Some genes are inherited from parents and so on, which makes some individuals to be more predisposed to certain mental health conditions. Some social factors too can predispose people to certain conditions. For instance, if we look at our present state in Nigeria now, a lot of people are predisposed to high stress level. And stress is one of the main ingredients for people coming down with mental health. It is a major trigger for a lot of mental health conditions that people have vulnerabilities for. So some people actually can come down with mental health. They are more predisposed to mental health conditions than others.
Yeah. So it's safe to say mental health challenges is not a respecter of age, gender. It can happen to anybody. However, it's on the lines of there are risk factors, like you have mentioned.
Yeah.
You can be predisposed to it. It can be genetic and it can be environmental.
Yes.
One of the biggest concerns that people have, I know there's a lot of stigmatization out there, but sometimes you hear the conversation that says there are no treatments available for mental illness. So it's like people feel like the moment you have a diagnosis, it's almost like you're done and there's nothing for you, there's no help. So can you speak to that?
Yes, that is one of the misconceptions about mental health that practitioners need to continuously educate people about. There is treatment for every type of mental health disorder. Just like I've said earlier, when people come down with physical health conditions, they go to the hospital, get diagnosed, and get the right treatment for their case. So same with mental health. It is always better that when people start to notice signs, they immediately go to the hospital to meet mental health professionals, where they will be assessed and then diagnosed and the proper treatment administered.
Yeah.
So there is treatment for every mental health, and people can get cured from a mental health condition and live normal life.
Great, thank you for that. What do we say to this general, word out there that those that have mental health challenge, they're dangerous, they're violent? What can we say to that?
People with mental health challenges are not necessarily violent. However, we cannot rule out the case of some conditions that might drive the sufferer to become violent, especially in some psychotic condition where individuals might have lost touch with reality. Let me give an example in conditions like schizophrenia or even manic depressive disorder, especially in the manic phase, where some individuals might become aggressive if treatment is not readily available at that time. But it is not as if every mental health condition makes the individual to be aggressive or violent.
Mm-hmm. So, safe to say that sometimes violence or some behaviors that can be seen as violent can also be symptoms of some mental health challenges,
yes.
And it doesn't mean that everybody who has a mental health challenge is violent or the person is dangerous. I'd like to also find out, people who have mental health challenges, there's that conversation that they say, they cannot maintain a job. The employment rate of some people can be low if you're seen to have a mental health challenge. Can you speak to that, please?
It is not true that people with mental health challenges cannot maintain a job. However, it is not impossible that there are they might be discriminated against in job employment because, just as we said, because of the lack of understanding about mental health. And people think, oh, being around said this person might be dangerous for them, and so on, because they've had this belief all along that mental health challenges is a dangerous thing. But that people with mental health conditions cannot hold down a job is not true. That they cannot perform optimally is not true. They can perform just as equally good as every other individual out there. So it is not true that people with mental health challenge cannot perform optimally on their job or hold down a job.
Thank you. Can you pray it away? Can you pray a mental health challenge away?
Well, no, you can't. You just have to seek professional assistance for it. It is not something that you can wish away or just say, okay, if I pray about it, it will go away. No, it will not happen. It is just similar to physical health condition too. When some people say they are praying because of this, they don't go to the hospital, and you see that condition gets worsened. So trying to pray away a mental health condition or locking somebody with a mental health challenge up in a house or in a room will only worsen the condition of that person. So the best we can do for people, rather than resorting to prayer, is to take them to the hospital where they can get help.
Yeah. I'm seeing that Nigeria is quite a religious environment, and religion is it plays quite a big role in our identity as people and the way we go about life and our beliefs. Is there a place for, let's say, faith-based practice? Is there a place for it, or in your care for a mental health challenge that should not be considered?
Well, personally, I don't encourage people relying entirely on prayer in the treatment of mental health condition. Mm-hmm. Yeah, like we said, Nigeria is a very religious country. We believe so much in God. Yes, you can pray at home for the sick person, but then take the person to where the person can receive treatment. Not that you lock the person up, you're now saying, I'm praying for this person, I'm doing deliverance also. No, take the person to the hospital where professionals will attend to the person while you can continue to pray at home for the person to get better.
I think it also takes me back to the conversation about, when I asked, is mental health spiritual? And you said, no, it's not, because scientifically, it's been proven to be A, B, C, and D. And if we look at it for what it is, that it's not a spiritual attack or a curse, then perhaps the treatment for it will also be different. If we know that something is not spiritual, the solution to it would not be to go exactly, but then, like you have said, there is place for it because of who we are, and because of our faith and our beliefs. There is place for it, but it should not be. We should not take away the bigger picture of the way it should be treated, and just solely base treatment on a faith-based approach to the work, to the treatment of mental health challenge. With young people, a lot of them think, I'm invincible, nothing can happen to me. I wanted to know, is it rare for a young person to have a mental health challenge? Is it rare, or is it, do young people get mental health challenges?
Actually, mental health condition is just as common in young people as it is in adults. But unfortunately, it is often overlooked because people believe, which is just part of the myth too, that young children cannot have mental health disorder. What are they thinking about? Because oftentimes too, we believe that people come down with mental health condition because of their thoughts, because of what they are thinking about or their worries and so on. Even babies and toddlers can suffer mental illness. A research recently by the American Psychological Association points to that fact. that even babies, mental health conditions can be diagnosed in babies. Now, how much more adolescents and teenagers and so on. So, but the unfortunate thing is that we often overlook the signs in children, and perhaps sometimes too we don't even know what to look out for. So this is where the place of education comes in, where professionals need to continually enlighten the society, educate the society, sensitize the society about many of these mental health conditions, and especially those that the younger ones can be more predisposed to at their age.
Yeah, and I find like with a lot of younger people also, they may not have the words to express themselves and to say, this is what I'm experiencing. And if we had to go by, textbook definition of some symptoms, it may not always capture the way to present, or the way to show in an adult is not the way it will show in a young person.
Exactly.
And, as we evolve and as we learn, we begin to understand, the way a child would present with this, and we're able to identify it and label it. So it's safe to say that children also may have mental health challenges. And when someone is telling you, when a child is speaking to you or a young person is speaking to you, I think it's important to listen. Even if you don't know what to do, it's important to listen and hear what they're saying to you, because you could speak to a professional and they would be able to also help you identify that some things here are not adding up. So it's important that we listen to the young people when they also speak to us about things that they, about challenges that they may be going through.
Yes, absolutely.
Are mental health conditions, mental health challenges, are they permanent? Are they permanent?
Mental health challenges, are they permanent? I would say both true and false.
Okay.
There are so many mental health conditions that are not permanent.
Okay.
That are treatable. You treat them, the person gets better and continue to live normal life. However, there are certain mental health conditions that the individual might need to manage for the rest of their life from the point of diagnosis.
Would you give some examples? Would you help us?
Yeah, example could be in the case of schizophrenia, for instance.
Mm-hmm.
Schizophrenia is one of the most debilitating mental health disorders, and it is a psychotic condition where the individual presents with delusion, psychosis, sometimes disorganized thoughts, disorganized behaviors, and so on. These are the type of people that people see on the street and say, oh, this person is mad, and so on. And there are different types of it too. So such condition, when diagnosed, sometimes can only be managed over time, as long as the person adheres to treatment. The person will be able to live a normal life and continue doing their normal jobs, living their normal family life, and so on, if they are adherent to their treatment. Yeah, that is an example of a mental condition that you can say that is akin to management diseases in physical health.
Yeah. Can I ask, what are the common mental health challenges that we have in Nigeria?
The common mental health challenges that we have in Nigeria are, stress, if stress we qualify as one. Stress, anxiety, depression, bipolar disorder. That is both bipolar disorder 1 and 2. Mm-hmm. And schizophrenia itself too. And these ones are pretty common. However, some conditions seem to be coming up now too. Attention deficit and hyperactivity disorder, and some conditions too on the autism spectrum. People are becoming more aware of them. Right. So these are the disorders that we have that are common.
Yeah, thank you for that. I think the key word there is also the awareness,
The
that there are quite a number of mental health challenges that people may go through, and they're all on the spectrum. They're not all, they have like severities,
Yes.
depends on what people are presenting. But because a lot of us don't know, and we think, and I'm glad you even mentioned it, that about, when we see somebody on the streets, we say, oh, that person is mad, that person has a mental health challenge. Sometimes you can see it, does it mean that if you can't see it, it's not there? Does it mean that if you can't see if the person is not on the streets, removing their clothes or running around, we won't identify the person as having a mental health challenge? I wanted to talk a little bit about that, because for a lot of people, once we say this person has a mental health challenge, they'll be like, but you're dressed nice and you look okay. How can you have that? You're not, you don't look like the typical person on the streets that we should expect. I would like for you to speak a little bit to that, And I guess for me, the question would be, is it always visible?
No, it is not always visible. That is where we talk about awareness. Sometimes we miss the signs of this condition in people. And that is why, for instance, an individual might be going through suicidality, having some suicidal ideation, and so you might not know that this person is having these thought processes in their head until perhaps they are able to come through successfully in killing themselves. That's when you know, okay, this person must have been suffering some things. Some of these symptoms are not very, very visible, and most often we get to realize that something is going on when it has reached the extreme. That is when perhaps now, okay, the person is becoming aggressive, violent, or the person become a vagrant. They will now say, oh, okay, he has a mental illness. But then you can have people, you can have even kids at home who are suffering, but you don't even know the sign. And you might even be contributing to their condition because you don't know that this is what they are going through. You begin to say things to them that will further aggravate their condition. So the most important thing for us to do is when we begin to notice signs that seem awkward, then we should be patient, be empathetic enough to try to find out what could be going on in the life of the person, in the life of that child, in the life of that adult, and then try to see if we can help them to get assistance for whatever condition that they may be having at that point in time.
Definitely. I think, the key word you also mentioned there is empathy, just having some understanding about the person. There's a lot of I think a lot of Nigerians are going through a tough time. You may not always show. Some people it will show, whether in their behavior, in their emotions, but a lot of people it may not show. So I think a little bit of understanding would go a long way to helping us help each other. And my final question to you, I hope it's my final question, because I may bring up more. My final thought to you is, for a person who has been diagnosed with a mental health challenge, a lot of them think it's a death sentence. I'm never going to have a good life. I can't take care of myself. I can't live a healthy life. I'd like for you to speak to that. What do you have to say to that? And what do you have to say to that narrative about the person?
Yeah, my message to people is that mental health conditions, mental illnesses, are like every other illnesses, are like every physical illness that anybody can come down with, and they are treatable. Now, having a mental health condition is not a life sentence. But the most important thing for sufferers to be able to live a wholesome life is for them to adhere to treatment. Sometimes adhering to treatment can be pretty difficult, because it requires a lot of lifestyle changes, and then you have to adhere to certain strict regimen of treatment, which might include medication and some therapy and so on. It can be frustrating sometimes, and it can be very, very stressful, and you might want to feel like, this thing is getting too much, I don't want to go ahead with this anymore, or you feel better at certain times and you feel, okay, I'm very much okay now, I can live my life. You won't know when the relapse will come in. So it's always better to adhere to treatment program. And when people are diagnosed with certain mental health condition, it requires lifestyle changes. It might require lifestyle changes. That if people adhere to such things, to their treatment program, it helps them to live normal life, and nobody will even know that anything is wrong.
Yeah. Definitely. I don't think I have so much to add to that, but I guess what I wanted to say is, like you've said, this is just me reiterating what you have said. Mental health challenges, just like any health challenge that you'll have, it will require some lifestyle changes, it will require some adjustments for whatever period of time that it is, that has been speculated. Like you said, it's not a death wish. Like you said, sometimes because of the nature of whatever you've been diagnosed with, there may be some changes in your life. So you might not go down a certain path that you wished, because your health requires, your life requires that changes do come. And it's important for us also as a nation, as we go through the ups and downs, because it's been a lot of ups and downs for the past couple of days and weeks. I don't know about you. Some empathy, like you've mentioned, and understanding, and, supporting people who say, hey, I need help. Like you said, when people speak up, it's about listening to them. It's about being there and being understanding. So, again, just give us your last words about the truths about mental health, especially in Nigeria. For the person listening out there, just give us one last word for that person.
Yeah, the truth about mental health is that mental health conditions are very real. Everybody knows that, but they are treatable. Mm-hmm. Mental health conditions are not spiritual conditions, and then you should not be seeking spiritual solution to a condition that is not spiritual. But that's not to say you cannot pray. Pray, because I believe that prayer gives people hopes too, that things will change. But pray while you are praying, do the right thing. And the right thing is to seek professional help when people come down with certain mental health condition. So thank you.
Thank you. So we have been speaking to clinical psychologist Hassan, and we've been talking about the truths about mental health. We have finally come to the end of this podcast. My name is Chinyerugo again. And if you enjoyed the podcast, remember to follow us on Instagram and on Twitter at Neem Sanctuary, and on WhatsApp at 0706 062 5054. I hope to hear from you again. Have yourself a good day.